हेलो।
हेलो।
हेलो मैम। हेलो।
गुड इवनिंग मैम।
Are all the team members here? Team A, one, two, three, four. Okay, and team D? Team D?
Ma'am, one more participant is yet to join.
One minute. We are just starting in 2 minutes. Hello and good evening. Hello, good evening, everyone. Can you hear me?
Good evening.
Can you hear an echo?
Yes, some disturbance is there.
Is there? Okay, just give me 1 minute. Is it better now?
Yes, ma'am. Yes.
Now it is good.
Fine. So, yeah, okay. Sorry for the delay. Good evening, everybody. I hope like we are at the end of the day, so everybody is still energized and not so tired. So, we have 4 members from Team A.
Yes, ma'am. Yes, ma'am.
Okay, can you just switch on your video for once so that we can see where you are? Okay, so you guys are together or you guys are at separate places?
We are together, ma'am. 4%
Together.
together.
Together, okay. So that would be great.
The
So if
team is
you can discuss
different places.
among, sorry?
The team D is in different places, ma'am.
Okay, fine. So we have a provision of breakout room. So if you require that access, you let me know.
Sorry,
Okay.
ma'am.
Okay, ma'am.
We have a provision of breakout room. Breakout room is what? That all your team members will be sent to one specific room for 2 minutes
Okay.
on the Zoom call. Nobody else can hear what you are discussing and you can discuss freely.
Yes.
Okay, so you can ask for breakout room whereas and when required. You get at least 2 or 3 access you will get. Okay, so good evening, everybody. Here we are back with us for our last round of debate. Firstly, I'd like to welcome Bhargavi ma'am and Joyanta sir, and for considering this late session as well. Thank you so much for that, ma'am, and thank you so much for that, sir. And so today's topic is: should deglutology be considered as a separate subject? So we have two teams, Team A and Team D. Team A, let's pick up the sides now, for and against. We have two chits, white and yellow. Which one? Team A, choose one chit. Choose one color actually. Team A.
Yes, ma'am. Yes, ma'am.
Yeah.
Yes,
One you
ma'am. Yes,
want.
ma'am.
Can you repeat? I couldn't hear you clearly.
Actually, the color isn't visible.
Visible. So this is right, this is left.
There's a lag in the
Which
video.
one? Right or left? Just
Okay.
choose one. Right or left?
Right. Right,
Right.
right,
Okay.
ma'am. Right, ma'am.
Okay. 4. I don't think it's visible, but it's 4. So you guys are fighting for yes, deglutology should be a separate subject, and Team D will be debating for no, it shouldn't be a separate subject. It can, like how it is right now. We can go ahead with that. Are we clear on the topics?
Yes, ma'am.
Team A, B. Okay, fine. Sorry, Team A, you have some query?
No, ma'am, we'll start.
We'll start. Okay. So on behalf of our organizing secretary, Prasanna sir, and entire team SLP Quest, I wish you all the best. And so basically, I'll just brief you all with what are the rules of debate. First round is introduction round. You get 3 minutes to introduce the topic. And the resource person, who's the resource person in Team A?
Shruti. Ma'am, myself Ashwati and Divyasri.
Ashwati and Divyasri are resource person in Team A. Okay. And so Aisha and
ma'am.
Shala are the speakers. And Team D, who is the resource person? Team D.
Aisha, Spurti HS, and Prince Srivastava.
So they are Prince Srivastava is?
All three are resource persons. I'll be the speaker, ma'am.
No, we have 2 resource and 2 speakers. So you can decide among yourself.
Okay.
So 2 people can speak during the debate.
Yes, ma'am.
So who is going to speak with you? Suruthi and
Spurti HL will speak, ma'am.
Can you come again? So, you and who else?
Shruti and Spurti. Spurti.
Spurti. Okay, Spurti. Okay, fine. So you both are the speakers. Fine. So the introduction round will be done by the resource person, and so you get 3 minutes to give the introduction of the topic, and then we come on to the debate round. You get 15 minutes to debate on the topic. Only the speakers are allowed to speak during the topic, during the debate. Then later on, next round which we have is Q&A round. You can ask, team A will ask one particular question to team D, and there will be no further comments on that. Team D will answer as they find it appropriate. And team D will ask a question to team A, and no further comments will be taken on that. And even the judges will be asking a question to each of the teams. And last round will be the conclusion round. For that, you get 3 minutes to conclude your debate topics, and that will also be given by a resource person. So are we clear on the rules? Team A, Team B, are we clear on the rules?
Yes, ma'am.
Okay. So if one of you all can at least, switch on the video, and so it will be better for me to understand whom I'm communicating. So while debating, there are a few pointers. So basically, while debating, you make sure that one person speaks at a time, because we are on an online portal. So we have to make sure that our points are, through and they get to the judges. So that is why one person speaks at a time. And if I feel that, some person is taking all the time of the debate and not letting the other team speak, then I might have to stop that person in between, and then the other team can continue with the topic. So it's going to be to and fro. So D, team D, do you need 2 minutes of break room time to before we start the debate?
Yes, ma'am. We require.
Okay. So team A, you don't need, right?
Not for now, ma'am.
Okay, sure. Then team D, I'll send you into the breakout rooms. So you'll get a pop-up on your screen. Just accept it, and then you will be taken to the breakout room. So are we all back?
Yes, ma'am.
Team D, are we ready?
Yes, ma'am.
Okay. So we start with Team D. Your 3-minute timer for introduction starts now.
A very good evening to one and all here. I and my team will be presenting against the
1
course.
minute. I'm sorry. So you are the speaker, right?
Yes, ma'am.
So the resource person gives the introduction. Introduction and conclusion has to be given by the resource person. Can we start, Team D?
Can I proceed, ma'am? She is not keeping well.
You have 2 resource people, right? Prince is also there.
Yes, ma'am.
The rules have to be followed, right?
Yes.
So ask Prince or somebody to just present the introduction, because the conclusion also has to go to that person. Team A, are we ready?
Yes,
Yeah.
ma'am. Yes.
Okay, so we are starting for now with Team A. That much of concession has been given to Team D. Till then, Team D, just get it cleared with between your teammates. Team A, start.
Okay. So good evening, everyone. Today we are gathered to discuss a question that holds significant implication for the future of healthcare and the specialization of our field. Should deglotology, the study and management of swallowing disorder, be established as a separate course? So as we all know, swallowing disorders or dysphagia impact millions of lives globally, affecting the individual across age groups and medical conditions. The assessment and management of these disorders are complex, involving the understanding of anatomy, physiology, and neurology, which are crucial in preventing life-threatening complications and enhance quality of life. So in light of this, our team advocates for establishing deglotology, a dedicated course. A focused course would produce experts equipped to provide better patient care, improvement, and reduce the risk. So in light of this, I welcome each of you to engage with us to delve in the arguments surrounding this critical topic. Thank you.
Okay, great. Team D, are we ready? Team D.
I'll be presenting the introduction and conclusion.
Okay, but then you'll have to bear the cost of -3 points. Is that okay? Okay, go ahead.
Sorry for the inconvenience.
No problem. Continue.
Yeah. So I will be presenting the case against deglotology being a separate course. So as we all know, deglotology and swallowing disorders is very important, and it is attention worthy, but making it a separate course is not what we believe for. Instead, integrating the same curricula into the existing curriculum of the speech language pathologists would be more effective and sustainable, is what we believe. So the reasons for that are: creating a separate course would require a lot of input, especially from the educational institute and for the resource people, that is the teachers that they need. So currently, we have only 5,000 speech language pathologists who are available to serve the whole of India, that is a population of 50 million people. So when we consider that amount of demand, narrowing the focus on deglotology furthermore will be more constraining for the speech language pathologists area of work. So it will reduce the number of people who are qualified enough to treat people or attend to the population that is in current demand. So, and also when we take the point of the cost that is needed to create a separate course. So we will need to pay a finely qualified experts in the field, which are very few, and they will have to be paid even more extra. And the instruments that we need, the fees, the manometry, and all those will be more expensive, and the amount of clinical demand that we will need for training students is also going to be more. So the institution will be paying more, and the cost will be shared by the students. They will have to pay in lakhs to get such amount of qualified education in a duration of 2 years. But the same can be done in just a period of 5 to 6 months of education, as we have now in our master's course, with additional support from people like the team of SLP Quest, where they are putting forth courses and workshops to reinforce our skills, refine our skills in treating patients with swallowing disorders. So my idea will be to encourage people to learn dysphagia more rather than making it a separate course. Thank you.
Okay. So now we start with our debate round. So you will get 15 minutes for the debate. It will be to and fro. Each team can put up their points. So now we had started with team A. So we'll start with team D. Team D, you can put up your first point.
Can I give the question now?
No,
So
not the
the
question.
first,
The debate. So you have to put up your first point. They'll counter the point and that will go ahead now.
yes. When it comes to getting employed as a deglutologist, so the chance of being employed as a deglutologist would be much more less than being employed as a speech language pathologist, who have wider area of reach. When it comes to a hospital, you will be able to treat patients with communication disorders as well, and also in deglutology. But if you are expecting to be paid such a huge amount only to treat swallowing disorders, when the others are qualified enough and they are able to do the same quality work as you, why would you want to give such a chance, such a duration of your life to do to be employed in such a very less possibility?
Okay, thank you for this valuable input. So here I would like to quote, apart from thinking perspective of the economy of our country, focusing on to a stand of patient perspective, like if we were a patient, if we are standing in the shoes of a patient, they would always prefer somebody who is specialized in the skill set of swallowing disorders rather than somebody who is in a broader thinking mind. So here, if you ask about the employee perspective, like how they would be recruited based on our India's economy. So here, for India to reach its milestone of economical growth, a specialization of a medical professional is always necessary and crucial. So here, if I would like to quote, in the 2019, there is this Indian Annal of Neurology, where they have rightly quoted as we have around 2 million population of stroke. So in this scenario, if, as you have said, about 56 billion of India's population, 2 million is with a stroke, and dysphagia being 50% of a symptom in the stroke population, apart from giving an overall like a holistic approach, they would always prefer a specialized skill set, which I should emphasize, a specialized skill set and a specialized knowledge, like directly diving into the field of dysphagia. So here I would like to quote that because dysphagia being a specialized course is not going to yes, it would affect the financial thing of our country, but here considering the economy's milestone which India has to face in future, a dysphagia specialization as a medical professional is mandatory.
So that was a very good point, but it is not valid enough to go talk for a course that is to be created from scratch. So why not train the personnels who have already had the education about the neurophysiology, the mechanism of swallowing and everything? Why don't you just train the existing professionals who are having the basic knowledge rather than going to someone training them from scratch? Why would that be important?
I believe like the question that you put out is a valid question, but to answer that question, I think when we look into the division that is masters in speech language pathology or masters in audiology itself, there was a dire need for dividing it in such a way because it was necessary at the moment for students who have interest in that field A, B because there was a need for clinicians who have a specified skill set in that particular patient population. So hence, considering the amount of knowledge that is given to a student in their 4-year degree course, it is not sufficient enough for them to treat a patient population such as dysphagia, which comes under a high risk. So when we think about in that way, it pushes the need for a separate course. Is what I think.
Okay, so thank you for your answer. But I would like to put up another answer. So currently we are doing our masters in speech language pathology, which itself is a specialization, right? So in that specialization, we have learned about deglutology. So suppose someone else has done their 2 years of course in deglutology and they are treating a patient, and a person with master's degree in speech language pathology is going to treat a patient. So if a person is having a weakness in their oropharyngeal phase, what exercise would they give? It would be the same. The people who have learned deglutology for 2 years, at this time, they are not going to use some magic that is different from the whole other world in treating the patients. So how do you answer that?
The difference here actually lies, I think, in your question itself. So here, deglutology is a specialization of 2 years, we believe. And as you rightly said, in Masters of SLP also, we are doing 2 years course. And the particular diagnosis, which is oropharyngeal dysphagia. So in an MSc SLP profession, yes, of course, we come across different patients of different diagnoses. Obviously, we are checking the cognition part, language and every holistic approaches we are doing. But as a deglutologist give his or her own approach to that patient, it is vividly different from how an MSc SLP would treat. I would like to add on to this, like the evidence which I could show you is, for example, if a patient has come up with the symptoms of oropharyngeal dysphagia and an MSc SLP is treating the patient, we would start with the whole history, medical history, the follow-up, everything. Whereas a deglutologist, keeping apart the holistic way of diagnosing a patient or treating the patient, the deglutologist would directly focus on the primary complaint, which is dysphagia, and it goes like they would correlate with the medical aspects and all others, and they are exclusively experienced only in dysphagia in the past 2 years, whereas MSc SLP is not. I believe I could reach to your point of question.
Yes, but my question was, how is your treatment? So if I am treating a patient, I would use vital stim, I would use the same exercises as a deglutologist would use. So I am aware of all the basics. I have the basic knowledge. I am having access to all the new research that is happening all over the world. I have access to the dissertations or anything that is happening inside our colleges as well. And we are attending workshops, we are attending conferences. And what difference does it make for the patient? Anyways, ultimately, it is the same exercises that they are going to get. We are also treating, like, if you are telling it that you are not looking holistically, it is a minus point in your side, right? If you want to look at only no, can you tell your employer, no, I'm not going to see anything else, I will look at only swallowing and I will leave. So will that be impactful, or me treating a person's communication as well as their difficulty in swallowing? Both together would give a much more clearer and fruitful impact in the patient's life.
Okay, actually, I quoted the which you have said it as a minus point where holistic thing is not there. It was like for a deglutologist, the holistic perspective is existing, but not in the terms of dysphagia. They are not equally comparing it with any other symptoms of the patient who's exhibiting it. So here, as you rightly said, we would do vital stem. So as an MSc
That is just
SLP,
an example. There is
yeah,
a lot more than that we do.
yeah, there is a lot more we believe. So here as an MSc SLP, if around like past 2 years, how many patients, like if we take around this around statistics, how many patients would you have given an evidence-based and rightly proved vital stem treatment? And my next question is like, what if, as you said, like MSc SLP can also give the same exercise and dysphagia therapist can also give the same exercise. Then what about a BSLP experienced person with dysphagia? They would also give the same exercise. That's
Yes.
like we are still specializing to MSc SLP is to master what is specifically in that program, not just like as you said, like it is different. It is different in the way we view
In what
patient, the way
way?
we treat the patient. Like the same question we can ask to a PSLP fresher who is very experienced, not fresher, who's experienced. They getting experience in swallowing disorders and MSc SLP getting in swallowing disorders. So are we trying to make it equal, like the way the both are treating? No, the profession differs. Like one has been gain an extra qualification and highest qualification of the degree, which they have come across solely for that purpose. That's why it was differentiated apart from audiology. So there always need a differentiation and specialization within a generic
But
perspective.
whatever you are telling would happen in a course of 10, 20 years. So the demand is right now. So there is a demand where the whole of India has to be covered with just 5,000 speech language pathologists. How many deglutologists do you expect right now to be there available to treat speech swallowing disorders in India? So, there are only 2 deglutology courses all over all over the world.
All over the world.
Yes, I know of only 2. One in India and one in Belgium.
Then all over the world, there are other colleges too. Like, as you said, Belgium is offering,
Only for deglutology.
yeah, only for deglutology specialization. Europe is offering, European Society for Swallowing Disorders has been offering. Canada is also promoting those who are specially in deglutology rather than an SLP.
It would just be a additional course, like a short-term period course, but a master's in deglutology is offered only by 2 colleges. Please go verify that
Okay,
on the
Belgium,
internet.
KU Leuven University, Kerala Amrita University, and Trinity College in Ireland.
Trinity College, please verify it is along with speech.
No, they have specialization for deglutology, swallowing.
Yes, specialization along with speech.
Speech, I don't think so, because speech is not
Yeah.
along with deglutology, because see, apart from
think it is a
India,
long
if we look into this international, if we look into the international perspective, anyway,
Okay, so
can you,
like what difference does that make? 2, 3. Okay. How,
okay,
from where do you expect to get
yeah,
experts from?
okay. As you have gone through the
You will
international
have to bring them from other countries to India to teach people here. So how do you plan to manage that costs? Will you be willing to pay in amount of crores for completing a 2-year course, or do the same thing in a government recognized institution in India that I still pay only to 20,000 here. I get the best educational qualification that everyone can get. It depends on the skill that we have, which projects ourselves as speech language pathologists who are specialized in swallowing. So anyone with the basic knowledge who has the skill to treat people with swallowing disorders will be worthy of being employed, will be worthy of dealing with the demand that we have. And I truly support in building the skills of persons who already are having the basic knowledge. I don't want people to be built from scratch.
okay,
The first priority should be in upskilling the person than bringing it from.
okay. As you have gone through the international perspective, I would like to compare the national and international perspective matter. So here, as you rightly said, are you going to pay crores to get a faculty from Dublin or Ireland or wherever it is? And are you going to, the second question was, are you going to just focus on this upskill developing of our SLPs, or again going to the deglutology who is just 3 or 4 in number? So here it is purely a medical perspective. Internationally, with the MSc SLP course like Masters in Speech Language Pathology, if you go to European countries, for example, the Belgium, the Netherlands, the UK, wherever, the pay we are getting, the pay also you have quoted, and the faculties, the pay we are getting, and the chances, like for an MSc SLP itself, the chances are very less, like internationally. In India, it's very abundant. In India, we are more into research, clinical practice, and every field, because we are treating both child, both neuro, onco, every patient. Whereas internationally, still we are facing different issues which come across just after passing out MSc SLP. So if you question the 3 or 4 in number in a medical perspective, then I would like to question the same thing. Like, for example, an MBBS doctor is thousands and to thousands and millions of people can happen in India. But the specialization
Just
is
to add
always.
on, I know people who have gone abroad to
1 minute more.
Yes.
1 minute
Yeah.
more, put on your best points, and we'll end the debate.
Yes.
Yeah.
Yeah.
Specialization is
I
always.
know people who have specialized in deglutology, spending crores growing abroad, and still coming back to our own India, and still they are working in India. So, how do you answer that?
Yeah, I would answer it. Then MSc, after completing MSc SLP, like 7 years back, I know people who are still in Europe and UK still struggling for a course other than audiology. So for them, there is
Yes,
no
when
answer.
we have a broader, wider opportunity, even then, wider range of knowledge, even then we are not getting the opportunity to work. So why would you want to even more narrow down your opportunities by learning only deglutology?
I think that's not, I think this narrowing down is, no need to take that narrowing down as a negative perspective. Narrowing down is
Like,
always a
what is
better,
the use of
because
going
the
so
quality.
deep into the subject without even creating a possible impact on the society? You first create the impact on the society and then go deeper into the subject. That would be more acceptable.
But I think the need for a separate course came
Yes, the
because there was
need. Yes, it is the need that I'm talking to. The need for speech language pathologists who are specialized in swallowing is more needed in India?
Okay. So guys, it's going very interesting, but I don't want to stop, but I have to stop y'all. So we end the debate over here, and then now we move on to the next round, that is Q&A round. So team A gets the chance to ask the question first this time. Team, okay. Team D, you can also prepare your question if you want to communicate with your teammates. Team A, we are ready.
Yes, ma'am.
Team D, Team D, are we ready? I think she's.
So I'd like to put up a question.
Team A turn to put up first. Team A ask the question.
My question for the team D is, in a patient perspective, who do you think could provide or would be more better equipped to provide a better quality service to the patient? Will it be an SLP specialized in digitology? When the patient's complaint is specific to digitology, will that person be more equipped, or an SLP who is just specialized in MSc?
Of course, an SLP who is specialized in deglotology, because it is integrated into our curriculum as well. We do have the experience, we do have the qualifications, we have the experience, the exposure that is required to treat patients
Once
equally
again, I think,
as deglotologists.
yeah, it is not MSc SLP specialized in deglotology. It is MSc.
MSc and SLP as well as
No,
like
but the answer was
Please do not say 1 minute, 1 minute. This is a Q&A round, not a debate round. So you asked the question, she answered. That's all. Okay. Answered, question is answered. You want to add something more? Okay. So now team D ask a question to team A.
So I put up the same question that I have asked you before. So it is that just a minute. So what different techniques that a speech language pathologist does not know do you use in treating your patients? I'm sure you're aware of the curriculum and the
so.
areas.
Yeah. For this, I would like to answer from the point of view which you have given before. from Amartha University, if they are taking MSc deglutology, they have along with the course, they have special certification for fees, which is flexible endoscopic evaluation, which is very important for diagnosis, and VFS equally. And I think the more patient they see with fees and VFS comparing to MSc SLP is more, which can give a qualitative treatment for the patients.
No more
like-
arguments. No more arguments. This is a Q&A round. Okay. So I will request the judges to ask a question to each of the teams.
I've been waiting to unmute. Yeah. I so wish I was part of the participant. Yeah, but it was very interesting.
That's true.
Having said that, so to team A, I want you to explain specialization. Like we are talking about, should it be a separate course? Tell me, when does a subject or anything get separated?
One subject is separated when there is a need of a quality service for the patient. Like for example, from MBBS, ENT is specialized when there comes a need. And anesthesia got specialized into OT and OPD when there was a need. So in the same scenario, we as a dual degree, which we have gained in our bachelor's, then we are again specializing and narrowing it into SLP and audiology. So again, in SLP, there is a wide variety of disorders which we deal with. So again, a need comes when the patient's primary symptoms and complaint in neurology and oncology comes in dysphagia or deglutology. So
But there is some basic course, right? So we are talking about the 6 years of MBBS. And after that, we specialize.
yes,
I think the niche comes from the funnel, and that's what I believe Shruti was trying to explain. So that's where I don't know, correct me if I'm wrong, Shruti. And team D, yeah, so I asked the same question to you now that they are saying they have fees and they have done more VFSs. How are we differing? So now that we are saying that we have done the funnel and we are coming to the niche, how are we actually differing? I mean, we as in the speech pathologist.
Yes, ma'am. Thank you so much. When we say that we are doing fees and manometry and all those things, we have those courses to specialize also in Ayush, but in a very lesser amount that is to be paid. We have only 4,000 that is to be paid for fee specialization, and it is not like we are not having any time. It requires an amount of 1 week to get trained is what they have established from like they have been teaching, and they think that a period of 7 days is enough for us to learn fees and we can be very safe in doing that with the patients in just 7 days and with an expenditure of just 4,000 or 5,000. And SLP Quest has mastered in creating awareness and specialization, providing specialized workshops in doing that. So it is possible for us to do that also.
Yeah, so
With
another thing,
course.
so I understood. Another thing to both of you, and I think all of us, is deglutology only about instrumental evaluation? So yeah, so because predominantly we seem to be talking about that, and yes, there is a difference, the quality and quantity wise. People who are doing a specialized course tend to do more of that, but that's more for the diagnostic purpose. But after that comes the actual intervention, right? And I think at the level of intervention, we are still converging, be it from swallowing therapist point of view or a deglutologist point of view. That's where I think she's trying to say that electrophysiological measurement and all of that seems to be connecting there. So yeah, same, different again. I think previously. Yeah. So that's where yeah.
Okay, fine. So now we move on to the final round, the conclusion round. So you get 3 minutes to conclude your give your concluding statements.
Can we take 2 minutes breakout, ma'am?
Sure.
Yes, thank you.
So everybody is back.
Yes, ma'am.
Okay. So team D, you can start the conclusion.
So, as I've said, swallowing disorders, it is really a very important area to be concerned about. And my belief and the actual truth that would be important for our India is integrating deglutology into the curriculum, bringing it more powerful in the minds of emerging speech language pathologists who would have more and more interest and more confidence in identifying and treating swallowing disorders is the best approach that we would have. And it would also give us more flexibility and a wider range of coverage of the people in need would be achieved through such an approach. Thank you.
Team A.
Okay, so over here, create separate course in deglutology is crucial for cultivating a specialized skills set in the assessment and the management of dysphagia. So over here, the for focused on the dysphagia patients, so they dedicate their practice hours in the clinical placement for the skills that go beyond their general scope of SLP training. So a focused technology program will provide benefits for the students who are specifically interested in the dysphagia, which provides an inner depth understanding and allowing for the mastery of advanced tools like BFS and FEES. So as advocated by prominent dysphagia specialists like Teresa Richard. So moreover, while some certified dysphagia courses are available post MSc SLP. So they often come with the time and financial constraints, so making streamlines and integrated programs more accessible options. So as far having access to with the deglotology specialization
Okay,
will provide inside confidence as
continue, finish it.
so like other individuals, how we consult an ENT specialist for a ear or nose of population. So which is a dedicated co will ensure that the practitioner can meet their needs and provide a care for the client. So that's it. Thank you.
Okay, it was a really good debate, quite interesting. And both the teams had put up very good points. I was not allowed to speak, otherwise I would have spoken a lot in between. Okay. Keeping a neutral face was difficult this time. Okay. So, but moving ahead, so there's judges will be scoring y'all, and the scores will be disclosed later on. You guys have to start preparing for your round 2, that is model making, and get the models ready by 21st of November. So I'll see you all in IBC. I hope you all learned a lot. That was the whole idea behind this debate. And it was really nice seeing all the young minds debating on various interesting topics, which are still query in our minds. And I would also like to thank Joyanta sir and Bhargavi ma'am, who are really busy in their schedules, but still they took out the time to be here with us. Bhargavi ma'am is a well-established clinical practitioner in Chennai, and Joyanta sir is a lecturer at JYJNISSD Mumbai. So thank you so much, sir. Thank you so much, ma'am. It was really nice having you here, and your insights were really helpful for our students.
Thanks, yeah. So though the working person in me was tired, the student person in me was pretty much active. So, yeah, we always
That's
have.
true. That's true.
Yeah. Good.
Actually, that topic was really good, and both team really nicely presented. But although just I wanted to put a few points there. See, when we are talking about a course, it should not be like the students are might be thinking that course like in this course any student can enroll, like any background from like science group and all that. The students also using the term using like any student from Sketch can enter in this course. That should not be possible, because if we make this course running, then definitely the criteria should be like masters or BSLP level of entry, definitely. So, and in many colleges, when we are like dealing with dysphagia patients, we actually do not have that much of facilities. Like wherever like hospital setups may have this kind of facilities, like fees and VFS, but in institutional level, if you see, we actually don't have this kind of instrument in my as example my AYJNISSD. In any regional center, we don't have that fees facility, neither VFS. But we have that particular topic. If we wanted to teach the children just subject basis, that is not enough for further practice actually. So in that scenario, I also thinking to have a short-term level of course, like post-graduation or post-master's level of course, that might be helpful for the student who are dealing with such a sensitive cases. Because when we discuss like dealing with dysphagia, it is not a cup of tea for everyone, and in some cases that can be leads to like life-threatening cases. So that's why this is my view actually. Right, ma'am? What do you think?
No, yeah, totally. I think like that's what I also again, there's no right and wrong here, and it's just how the field takes up its own personality, right? So that's how I see it. So when we did it is growth of the field is how I see overall when we go back to when I was doing my college, and when we were doing college, I think what we knew was very limited. And it's like, the field is here and we just keep moving like this, and the edge is always there, and we just keep expanding. That's exactly how I see it. So that, putting it that way, I feel both of the population that is coming out is going to have its own niche, and setting up those, like, again, people who want to, I think, go into more diagnostic deglutology aspect, I think deglutology as a course might help them more than people who want to get into the intervention aspect of swallowing. And that's how I see it, because I am more into intervention. I don't want diagnostics. So that's the case, then why should I do MSc deglutology? So, yeah.
Actually, the field is expanding. Like we are just not dealing with the same neurogenic patients. Nowadays we are also dealing with cancer patients,
Yeah.
and even like pediatric swallow also. So
Yeah.
in those cases, definitely
Yeah.
some extra knowledge.
No,
might be fruitful.
definitely each of the courses are going to, I think, yes, Battle of Titans is one, but moving along in the alignment and where is this person's strength. And I think abroad people are already doing that, right? People who do VFSs particularly is a separate SLP, and the person who does the intervention is more home-based and things like that. So maybe that's what, so those things can be more made into a regulatory body, and getting that into practice might help.
And we are also having certain new intervention strategies like vital stim.
Yeah.
So
Exactly.
EMS, all those things are there, so which means we can collaborate or something, we can plan it out.
Right. Definitely, it's like it is not limited to just assessment.
Yeah.
We need to focus obviously on the intervention portions also. Many different type of new therapy techniques are also emerging, which are not included even in our new books.
In
Correct.
new books, and I think intervention, people have for a long time looked these aspects only from just the body, and most of what we are facing now is more from the mind and all of that. So that's where I think Team A, when they were giving the introduction, physical, neurological, and I think functional or anatomical, she said, I wanted, I mean, my student self was like, where is the psychological aspects? Half of what we see. So that's where we are missing. And unless broader aspect is known to us, we will only be targeting the neurological, physical, and we'll be like, sab kuch dekh liya. Why are we still not finding the answer to it? So I think that's where the holistic picture also comes into picture. Yeah. Right. So let's take each other's strength and move on, is what I would say.
True.
Yeah.
Okay. So it was a really good evening, and
Okay.
we hope to meet soon and connect soon or collaborate soon for any further events. Thank you so much, all the participants, and thank you so much, Javed.
Thank you, SLP Quest,
Have a
for
good
this
night.
opportunity. Thank you.
Bye. See you guys.
Bye.
Thank you, ma'am.
Bye bye and good night.
Good night.